So our next presenter is Heidi Sturk. So Heidi is a director of e-mental health and practice, or EMH Prac at Queensland University of Technology. She holds a master's in organisational psychology from the University of Queensland and has extensive experience in applied mental health research and digital mental health innovation. She leads a collaborative program that integrates digital mental health solutions into primary care, improving clinician engagement, awareness, and the use of digital tools. So Heidi serves on several national advisory groups and has contributed to the review and implementation of the Australian National Safety and Quality Digital Mental Health Standards. Her work has fostered innovative workforce development initiatives, resulted in increased referrals to digital mental health services, and advanced the safe use of technology in mental health care. So Heidi will be presenting today on changes in the digital mental health landscape. So thank you, Heidi.
Not sure this is. Hi, and welcome everybody to this session today. First of all, I would like to acknowledge the First Nations owners of this land and pay my respect to their elders, laws, customs and creation spirits, and recognise that these lands have always been places of teaching, research and learning. And I'd also like to acknowledge anyone in the room who's experiencing mental health issues or caring for someone with mental health issues as well. So first of all, I'd just like you to put your hand up if you've heard of MPRAC or e-mental health in practice at all. So there's a few people who've heard of us. That's always nice. So we've been funded by the Australian Department of Health since 2013. So, and as my topic alludes to, there's been a lot of changes in the digital landscape since then. As you can imagine, we deliver free training and promotion and awareness activities and support about digital mental health to health practitioners around Australia. So this obviously includes GPs, allied health, and we also work with service providers working with First Nations people. And after COVID, there's been a real groundswell of interest from a lot of other clinicians in digital tools, obviously. So we've got like pharmacists have been interested. We've also had emergency departments, lots of guidance counsellors, teachers, workplace wellbeing, and also police. So they've been really keen to know some of these resources that they can talk about. We track uptake and referral to some of the key services, and we also advise the government on policy in this area, and we're involved with some of their initiatives. So QUT leads the partnership, but we also partner with Black Dog Institute, Menzies School of Health Research, and also University Centre for Rural Health, who are based in northern New South Wales. So what am I talking about when I talk about digital? So for the scope of our work, we don't include telehealth. We're really talking about particular digital options, but obviously these can be used via telehealth. Excuse me. So we've got your information or psychoeducation site, which is standard, but we've also got psychological treatment programs. And Australia is lucky to have some really good quality evidence-based treatment programs. And I'll be giving an example of that in a minute. These tend to be module-based. You do them in sequential order, and they're based on CBT, and you're getting the same information as you would if you were seeing a psychologist in person. And you can actually just work through it yourself, but some of the programs also offer clinician support too. Then you've got what's called symptom management and wellbeing tools. And this includes your apps. So lots of people say, oh, what sort of apps can you recommend? Tell us about apps. And we need to be really careful about apps because there's so many out there that aren't evidence-based. There's no research has been done on many of them. It's only about like 3% that really actually have any evidence behind them or are evidence-informed. But they're really good in terms of teaching skills. So if you've got like a meditation app or mood monitoring app where you're learning about skills and you're practicing skills, and so it can help you manage your symptoms. And there's some websites and some programs also do the same thing as well. You've got peer support, which can be available via moderated forums, and it's really important that they're moderated so that anything that's talked about is safe and monitored, and also can be done by phone. You've got your counselling and crisis lines, which also have web chat. And these tend to be like Lifeline, Kids Helpline, Beyond Blue. And then you've got screening and referral tools. So some of the websites you can go in, do an assessment and learn about what might be happening and then have a referral to a relevant digital tool. And then the social and emotional wellbeing tools for First Nations people as well. And we just want to say that while we're talking about these options, we want to make it clear that these aren't a panacea for everybody. It's very easy to go, oh, well, here's some digital tools, let's all use these, but they're not going to be suitable for everybody all the time. But then we know that many people aren't seeking help or getting help at all. And so obviously these are fantastic resources to know about. And many of the clinicians that we talk to know a bit about the phone lines, but they don't necessarily know about the treatment programs or which particular apps they want to recommend, and they don't know about peer support either. So you can use these in a number of different ways. You can use them just to recommend or refer somebody to a particular resource and they can just use it on their own. And you might want to follow up and see how they're going with that. Or for clinicians, they might want to use guided support where they're actually coaching the person as they use it. And obviously this depends on your profession and what you're doing and how the scope of how you can use these. Or you might refer to a program that has clinician support. And then there's blended care, which is a term that's being used a lot more in recent years about where you're actually combining the digital with a face-to-face intervention as well. For example, a clinician might refer someone to an insomnia program, and that person works through that insomnia program in between sessions. While they're in the sessions, they're focusing on other things, but then they can also talk about the insomnia program as well. So it's helping free up clinician time to spend on other things as well. And you can obviously use these for wait lists and discharge as well. So talking about digital mental health in Australia, just a little snapshot of the history. So the government actually established an e-mental health strategy back in 2012, and there was 3 key aspects. So they had an online portal where you could search for particular supports, particularly government funded, free, low cost. It was originally called Mind Health Connect, but now it's called Head to Health. Hands up if you've heard of Head to Health. Well, so quite a few. That's good. And obviously Head to Health now has some centres as well, in-person centres, which are now called Medicare Mental Health Centres, and there's also a phone line as well. Then they've also got MindSpot, which was set up at the same time. And this is a virtual clinic out of Macquarie University, and it offers free assessment and treatment as well. So they actually offer psychological support and have a number of different programs, and I'll be showing you a screenshot of that in a second. And then there's us to do the training and support to primary care practitioners. And one of the things we've really found over the last sort of 11 years is that while we've been funded to do all the work with clinicians, which has been great, there's been a lack of a marketing campaign to the general public. So like a lot of people don't necessarily know about Head to Health, they don't know about these digital tools. And so when we're going to conferences, people go, oh, well, I wish we knew about this. So yeah, but they didn't have the budget for it, unfortunately. But I think that's something that we keep saying. It's really important that you do a marketing campaign so people know what's out there, how to use them, and the things to be aware of in terms of safety. So obviously Head to Health, as I mentioned before, that's just a quick snapshot. They do get quite a few users each day. This varies depending on the month. And they did do, a couple of years ago, they did do a marketing campaign over Christmas, and they really saw big intake then too. So I really would like to see them keep doing that. And you can see the top search terms, anxiety and depression and mental wellbeing and carers are probably not surprising to any of us in this room. Then there's MindSpot that provides the psychological care. So you go online and you do an online assessment, and then they will always have somebody from MindSpot contact you, ring you up and talk about what the assessment is showing and whether maybe one of their treatment programs might be useful for you to do, or whether in fact you want some other services that might be suitable for you that are local. And they actually interestingly find, and they didn't expect this, that about 70% of people who do an assessment don't want to do a treatment program. They just want to have more information and more knowledge about what they're dealing with, which is really interesting. They do have 8-week courses with optional therapist support, so you can actually do them on your own. But if you want, a qualified psychologist will contact you each week by phone or by text to support you as you're going through that course. And we know that when you're struggling, it's really good to have someone helping guide you, because it's so hard to be motivated if you're not in a good place. And they've also started a teletherapy option, which is really good for people in rural areas who don't have good internet or aren't confident in using the internet, so that they can have support via the phone as well. And you can see there that nearly 40% of people who use MindSpot have not spoken to a health professional at all. And they actually find that many of them have actually got quite severe symptoms because they have gone years and years without actually getting any support. And so when they get an average of 50% reduction, they actually find that they're much more functional and able to go back to work and do things that they weren't previously able to do. And there's some good information on there for anybody who's wanting to know more about it as well, with their FAQs. And then, of course, there's us. And while we're aimed at health practitioners, anybody can access the downloadable resources. So the training resources are more for practicing clinicians, but we've got a number of different options on there. So we've got a directory of digital mental health services in Australia. Again, the majority of them are free, I think about 98%. So you can search for those. We've also got a resource library where there's guides, brochures, links to webinars and the modules. So the webinars and modules are where you need to be a health practitioner, but anyone can download the blogs and read the newsletters as well. So anything's available on that. We're keeping on adding to that all the time. So yeah, blogs and newsletters. Now, Grant talked a lot about safety and quality earlier. The government has actually been aware that this has been a really important problem as digital tools have evolved, and so they've actually established some safety and quality standards for digital mental health services in Australia. And they try to ensure that they have good confidentiality and good security measures so that users can feel confident in using them. And so these standards assess the apps, programs and services against 59 different actions under 3 standards, and it's a really comprehensive process. I know the services who've gone through to get accredited, it's very detailed. They really have to be shown what are they doing with privacy, what are they doing with safety, and you can actually go onto the website, the Australian Commission for Safety and Quality in Healthcare, and it has a list of all the accredited programs, and we also have it in our materials as well. And they were originally voluntary, but any of the services who want to get funding have to meet these, so which is not a bad thing because it means that they're adhering to these standards. So just some current government initiatives. At the moment, there's a digital mental health navigation project, which has been led by the organisation SANE, who supports people with complex mental disorders. And they're looking at how digital solutions could support help seekers navigating the mental health system in Australia. So that's due to finish. That's been going since sort of mid-year, and that's due to finish by the end of the year. So that'll be really interesting to see some of them. They're going to come up with recommendations and costing suggestions as well about how this can better happen. And obviously that's going to link in with Head to Health as well. So the Head to Health team are sort of working closely with them to see what's going to happen, because we do get feedback that Head to Health can be a bit overwhelming and that there's so much information on there that people think, I don't really know how to start and which one do I choose? And then all the current government funded services are currently applying for more funding as part of a competitive grant process to make sure that there's not duplication and that there's gaps being addressed as well. So that's all happening right as we speak. I think they're all due in next week. And then there's also a National Early Intervention Service, which you might have heard about in the budget announced in May, so called the NEIS for short. And so this is going to be a digital platform which is going to provide free cognitive behavioural therapy delivered by skilled trained professionals by phone or video. And so it's based on the UK model. So the UK have a model called talking therapies, and so they're developing it from that, but they're also speaking to other countries about what's worked in their countries and what they're doing as well. And that's going to be up and running from the 1st of January 2026. So it's different to your crisis lines, which is more one-off, but this is going to be providing people, especially with the low intensity symptoms, to be able to get more support, so that they're hoping that they can free up psychologists and other health practitioners to deal with people with more moderate to severe symptoms. So just a quick snapshot. I was lucky enough to go to a International Digital Mental Health Congress in Canada in September. And so just to flag, these are the countries that are doing really good work in digital mental health. Australia is actually seen as a leader because we've actually developed some programs. We had one out of ANU called Mood Gym, which was developed 20 years ago, and we've actually developed quite a lot over the years. But a lot of these other countries are doing some fantastic work. And Scotland is another leader in the world, and they're integrating their digital mental health into the national strategies and really trying to make it as a normal part of life, not just, digital sort of off in its own world, but normal part of the health system. And they're also working with transforming clinician attitudes as well, because we know it can take time. Clinicians are, they've got their own way of practicing, and so learning about digital tools, spending the time to learn about them and how to use them isn't something that happens overnight. Ireland, they've also got a strategy that's aligning changes with their mental health priorities. Denmark, doing a lot of work and looking at current self-help seeking behaviours as well. Trust is seen as a really important factor, which is the same for us as well. Singapore, they had some really good presentations. They're actually using AI a lot in their service delivery and as a service offering. So they actually have a website that has a lot of information and guides people in terms of personalised sort of pathways of what will actually be useful, but they've also got a chatbot called Wiser as well. So it's actually an AI chatbot, and 20 to 30% of people who use the platform go on and use that. They're very transparent that it is a chatbot, so that people know what they're interacting with and that it isn't actually a person. And in Canada, they've launched an e-mental health strategy, and their Kids Help Phone are doing some great work with AI as well. So they are using AI for when anybody rings up, the AI is working behind the scenes to then help pick out words that's been used in the conversation. And so then those words then bring up resources that the counsellor can be using for the client rather than the counsellor having to take time to look them up, and also suggesting responses for the counsellor to use as well. So they're really trying to make it much more personalised rather than just a one-size-fits-all. And we know that some of the programs that are being developed in Australia are now doing that as well, that they're using AI behind the scenes in terms of someone can go in and say, do an assessment, and then the assessment will then guide them to go and do these aspects of a program rather than just a standard program, one size fits all. So that's where AI has been fitting in the background. And interestingly, there was a guy from the UK who actually talked about people using ChatGPT and Pi for counselling, and he did a bit of a study about people who are desperate to talk to someone at 2 a.m, didn't want to use a crisis service, so they were using ChatGPT, and some of them actually did say, oh, we found it quite helpful. And so they are just flagging that, if people are going to be using it, that we need to let them know that, it might not necessarily be safe that they're doing this, and it's not the data behind it's not safe. So it's going to be really important for mental health services and governments to be developing AI platforms based on safe data. So if people are going to be using this, and we know that they will. So some of the key themes internationally, trust and standards, as Grant talked about before, that's really important. And no digital tool or platform is going to be 100% safe. We do know that there's going to be hacking and things like that. But I mean, the accredited standards that Australia has set in is trying to go some way to at least do as best as we can for that. Integration, engagement and scaling. A lot of them are looking at how they can reach, as many people as possible who are interested, especially in some of the larger countries as well, where they do have limited health practitioners. Workforce development, they all know that it's really important to get clinicians on board. If we're wanting people to use digital services, clinicians need to know about them. Leveraging AI, that's been talked about in every single conference now when we're talking about digital tools. Peer support, how important it is that lived experience is part of development of these tools and programs. Youth is a big factor in all the countries. Definitely, I noticed that was a big theme. And it's also being used for First Nations, Indigenous communities, and also I was surprised at the extent to which digital tools are being used in disadvantaged countries. A lot of them do actually have good internet and they do have good phones. And there was an Australian guy from Monash University who actually presented about using digital mental health for deaf people in Bangladesh. And he's from Bangladesh himself. And in a population of 160 million people, they have 200 psychiatrists and 500 psychologists. So digital tools is an essential way for people there to get support. So it was quite interesting, and UNICEF are doing quite a bit of work in some of the disadvantaged countries as well. So that was, I was pleasantly surprised. So anybody who's interested, I'm happy to chat more about that. And so even though I'm talking about use of digital mental health, we do actually know that a lot of people are only dabbling in it. Like the ABS in 2021 found that 600 Australians have used some sort of digital tool for their mental health. And I imagine over the last couple of years that would have been going up a lot more. So, and a lot of it is just awareness of knowing what's out there as well. So we actually track up registrations to the government funded programs that you can see there. So these are all key programs that have they're well known in Australia, particularly amongst the clinicians. And you can see that registrations have increased. COVID obviously had a big impact, and it's dropped a bit since then, but it's still stayed above what it was beforehand. And then clinician referrals as well. You can see that's risen steadily over time and sort of settled a little bit at the moment. And that, there's still quite a lot of percentage of people who are accessing these programs are referred by a clinician, but keeping in mind that's underreported because it's self-report. So you might not necessarily remember how you heard about a program if you're looking at it, a couple of months later. Now, digital literacy is something that we hear about a lot too. We can't just assume that everybody does know about digital literacy. And obviously, today, in terms of forensic and prisons, we do know that there's often lower literacy among prison populations, and sometimes among rural areas as well. But we can't even assume that just because we have a phone, that there's always little things that we still don't know that we can learn as well. A lot of the programs are really aware of this, and they are making their content sort of much more simple and visual, and trying to have as less text as they can. Health professionals and support people can help. And obviously telehealth and doing FaceTime a little bit more during COVID has given people a little bit more confidence to go, oh, well, if I can use telehealth, maybe I can be a bit more confident in using some of these digital programs. And I know a couple of my psychology colleagues felt very daunted about using telehealth. And then once they felt more confident, they go, oh, actually, that was actually better than I thought. So maybe I can do this. And there are some courses at libraries, community services, and I also recommend the eSafety website. They've actually got some really good free online learning courses that you can help sit down with somebody. They're for seniors, for young people, for people who don't speak English as their first language. And they also have information about how to be safe online, and scams and all that sort of stuff, and what to look out for. Just keep an eye on time. One thing I want to talk about, and it was mentioned earlier too, is that language is really important when you're talking about digital tools, because it can be easy to feel like digital can be a bit impersonal and say, oh, well, there's this program or there's an app. And we hear from clinicians that say, oh, I just don't want someone to feel like I'm fobbing them off. But many of the resources do actually have that human connection component. If you're recommending someone to speak to someone on a peer support group or online counselling, or they actually are doing a program where a clinician is guiding them through it, they're going to still have that human connection. So it's utilising technology to get support, connection or treatment like we do for many other aspects of our life. And many of the self-guided programs and apps, they all promote human connection, because they know that that's such an important way of being, and for our mental health as well. And so it's important to us to sort of emphasise that these things can be used in our own terms, and so helping at our convenience and comfort level as well. So sometimes that makes a big difference, just the way you talk about something as well, and still acknowledging that there's limitations as well. So just a quick bit about MPRAC. Just to give you an idea of what we're doing and how we're reflecting the changing landscape as well. We've done lots of training over the last 11 years. There's a lot of different webinars on different topics too. So it's not just about digital mental health, but they might be looking at managing anxiety in young person, or reducing smoking, or better sleep habits. And so they then integrate how you could use some of these digital tools within that topic. So that's a really nice way to get people thinking, oh yes, I feel a bit more comfortable to just know what's out there for that topic. And there's some online modules as well, and we're wanting to develop more broader modules for the broader health workforce as well. Obviously, we do lots of promotion, conferences, presentations, and we also do a lot of hard copy materials, which I'll be showing you that in a minute as well. We also evaluate, obviously, the training that we do, and you can see there that it does make a difference in terms of confidence, and that health clinicians do feel that, oh, I've got a better understanding of how I can actually use these tools, and that they will change their practice. And obviously we know that a one-off workshop doesn't necessarily change practice, so no matter how much good intent you might have. And so part of what we do is also wanting to follow up and doing refreshers as well, because we do, I've spoken to a child news psychologist at a conference. She said, oh yes, I heard about this program a year ago, I meant to look at it, didn't have time, I'm definitely going to look at it now. So just reminding people as well, and even just to get familiar with something before you recommend it. So these are the resources that I mentioned before. So these are really popular resources that have been around since probably back probably 8 years now. We did start off with an A4 page, and just of some of the programs and listings in Australia. And I know a psychiatrist up in Cairns who had that up on his wall. And we now have a very detailed booklet, which is like this. And we've got some on the table outside as well for anybody here that would like to pick one up. And so this booklet actually has listings of low cost or mostly free resources in Australia. So you can look by topic or you can look by audience group that you're working with as well. It's on the website and it's downloadable, and you can order it as well via our website, and we'll post it out to you for free as well because we're government funded. So we do know that having hard copies is such a good way of just reminding people that these tools exist. So health practitioners often like just to have it on their desk, to tag it, they can photocopy, and it just makes it a little bit more manageable to, for a world that can be a bit overwhelming in terms of digital tools. And there's also some really good, just some brief brochures as well. And we've got some of those out there, I've put them in the front cover of the books, but they're also downloadable on the website and also available to order as well. Just in terms of our inclusion criteria, I'll be finishing up in a second, just mindful of time. And we include anything that the Australian government funds because the contract processes require safety and security and are now the accreditation. But any other services, and we're always getting contacted by services wanting to be listed as well, but it has to have an evidence base, it has to have robust IT safety and security based in Australia, delivering services here, and free or low cost. We do go lots of conferences because we reach different practitioners at these conferences just to let them know what's out there and having these resources there. And it's a really great way of talking to different people about how they use digital and what does work and what doesn't work for them. And we go to lots of rural places in Australia as well. So I think my favourite place was up in Cape York. I went to the very tip of Cape York because we were doing training in Bamaga. So yeah, it's a really different world when you go to some of those places. We also have a number of fact sheets. Sometimes people don't just want the booklet, that they just want to have a fact sheet on a particular topic that you can hand out to somebody as well. So it's good to know about those. We're still developing some fact sheets. So if you're wanting to look for a topic that doesn't have a fact sheet, we do actually do weekly blogs on different topics. And so you can just search on the right-hand side of our homepage and there'll be blogs that'll come up with some suggestions of different tools around those areas. And then just before I finish up, we have a podcast called Digital Mental Health Musings. It's been going for 4 years now. And this is where we talk to particular services, people doing research in the area, and this year clinicians about how they use some of these tools and some of the things that they use to overcome barriers or some of the things that they find are really helpful as well. It's available on the website, but also any standard streaming platform as well for podcasts. And there's can't think of the word now, my brain's thinking too quickly. It's transcribed. So if you want to just skim through the transcript as well, you can just do that as well. There's our monthly newsletter, which has information about new services or new tools if you're interested in that. And then there's also WellMob, which is a resource for First Nations people, because when we started our training, all the resources weren't in one spot. And so in 2020, our partner, University Centre for Rural Health, developed WellMob website, which is an online library of resources that are developed by First Nations communities and First Nations people. They tend to be apps, videos, more narrative style. And so they've put them together. It's a social and emotional wellbeing framework. And it's a really wonderful resource for anyone working with First Nations people. So they've done quite a few training webinars with GPs and psychologists and teachers so that they know about some of these resources as well. They have a number of different resource sheets because now that there's more resources, they've just highlighted some of the most popular ones that are, utilised, and there's hyperlinks to those as well. They have about 19 at the moment and they're adding to them, but you can see they've got different topics. They've got cultural identity, depression, how to be a good ally. I know they've got some on sleep, on parenting, impact of colonisation as well. And it was co-designed by Aboriginal people around Australia and it's led by an Aboriginal man as well. So where to next? Just before I sum up, we do know clinicians are really keen to use these now, and as they get more information and feel more confident, I've talked about the broader health workforce, talked about needing refreshers, doesn't happen over time, and people learn in different ways. So we like to offer different options. Some people do prefer to read, some people prefer to hear. The hard copies do have their place as reminders, and we just encourage practitioners to develop your own digital toolkit. Start with one or two, like maybe have one app that you know, or one peer support, or one program. Try it out yourself. Many of the programs have information for clinicians, or you can try it out if you're feeling stressed or needing managing your own sleep. Do it yourself, and it's a great way to learn how to do that. And so Final slide, just for us, it's still a lot of work to do to get a digitally competent workforce, because it is a new way of practicing and just knowing what's going to be best suited for your particular work. Obviously, we're reflecting government reforms. AI is a huge thing, so staying up to date with what's happening with that and letting clinicians know about that. A lot of people sometimes just want to have a little look through at a program, and so we're going to have some little videos so that people can just know, oh, okay, that's what it covers. So then they feel more confident to even start using it or recommending it. Developing a bit more, we'd like to use AI to develop a really good learning management systems that a clinician could go online, go, this is the sort of clients I'm working with, these are the sort of tools I'd like, and that we could guide them to something that AI could be utilised to guide them to particular training aspects that would be most useful for them. In terms of the overcoming barriers, obviously there's a lot that we need to address, and organisational implementation. There's not much use if we're recommending resources like to guidance counsellors and then they go, oh, but our school only lets us recommend one or two, that we know these things, we can't use those. So it's important that we know what their policies and procedures are. And a lot of the schools and organisations, even government departments, are now realising, okay, these accreditation standards mean that we can then recommend certain programs and tools. Obviously, including in tertiary curriculum is really important as well, so that practitioners go out knowing how to use these, and international collaboration so that we can talk and learn about what's happening overseas too. So thank you very much for listening, and that is taken in Palm Cove, one of my favourite places in Australia. Thank you.
So thank you, Heidi. So I think my journey with MPRAC started 10 years ago. And what I like, so as a practitioner, there are so many apps and digital resources out there that don't necessarily have an evidence base to them. So groups like MPRAC have done the hard yards and they've narrowed the field, they've organised it for us, made it easy for us to access online. And knowing that there's all of this out there that we can use with people that we work with in the community, and then also as we have these standards and frameworks, we can sort of share and reduce some of the risks, or convince people that we can reduce some of the risks for some of our clients in forensic mental health. So thank you, Heidi.